Have you ever found yourself sitting across from someone you care about, watching them go through an incredibly tough time and suddenly you just freeze?
Oh, absolutely. It's a
And,
really common feeling.
right. You want to help, obviously,
Right.
but you are completely terrified of saying or doing the exact wrong thing. It's that quiet panic of wanting to be there for someone, but not knowing the actual mechanics of how to do it.
Yeah, you freeze up because you don't have a script.
Exactly. Well, welcome to today's deep dive, where we are going to look at exactly that. Today, we are opening up a specialized set of medical guidelines. Our source material is this really concise document detailing the critical role of healthcare assistants, or HCAs, in supporting a person who is living with depressive disorder.
And it's a fascinating text because it's so practical.
It really is. The mission for our deep dive today is to extract these professional guidelines, peel back the layers of this text, and understand how frontline healthcare workers manage the daily, on-the-ground realities of depression.
Which is something I think we all can learn from.
For sure. But,
Exactly. It frames managing depression as profoundly tied to daily human-to-human interactions. It focuses on the environment, the mundane routines, and those seemingly small moments of connection that make up a person's day.
because when a condition impacts your energy and thoughts all at once, the whole architecture of your daily life just starts to crumble.
It does. And these guidelines serve as a blueprint for how a caregiver can help prop up that architecture while the person is healing. It goes far beyond simply keeping an eye on a patient. It is about actively providing structured emotional support, meticulously encouraging healthy habits, and relentlessly maintaining safety and routines.
Okay, let's unpack this, starting with the emotional support guidelines provided in the text. This is where the source gets incredibly specific and honestly cuts right to the core of human behavior.
It really does not pull any punches.
No, it doesn't. One of the very first instructions given to HCAs is a list of what not to say. The protocol explicitly tells caregivers to avoid saying things like cheer up or snap out of it.
Which is such a common knee-jerk reaction for people.
Right. On the surface, that might sound like basic common sense to anyone who has read, a single article about mental health. But I am curious about the clinical application here. Why do medical guidelines need to explicitly ban these specific phrases?
Well, what this document is doing is fascinating. It is essentially systematizing empathy. It's taking something we typically think of as a soft, personality-driven trait and turning it into a strict, actionable medical intervention.
Systematizing empathy. I like that.
Yeah, because when a well-meaning person says cheer up, they are usually acting out of their own discomfort. They see someone in pain, they feel helpless, and they want to quickly fix the situation just to relieve their own anxiety.
Basically making it about themselves.
Exactly. But clinically speaking, telling someone to snap out of it completely invalidates their reality. It sends this message that their current emotional state is simply a choice they can just switch off.
Like flipping a light switch.
Right. So by instructing HCAs to never use these dismissive phrases, the framework forces the caregiver to sit with the discomfort of the patient's pain. It mandates that the caregiver take the patient's emotions seriously and listen with empathy, rather than trying to rush them out of their depressive state with some cheerful cliche.
It's treating listening as an actual medical procedure.
Listening isn't just about being polite in this context. It is a clinical tool used to stabilize a patient and validate their experience.
It makes total sense. I mean, using a phrase like snap out of it for a condition that affects the brain's energy and chemical balance is basically like telling someone with a broken leg to just walk it off.
That is a perfect analogy.
You would never do that to someone with a physical fracture. But because depression is invisible, people sometimes default to these incredibly unhelpful bootstrap mentalities.
And the guidelines do not just leave it at what to avoid. They provide very proactive instructions for what the healthcare assistant must execute instead.
Yeah, the protocol mandates showing kindness and respect and maintaining a positive, supportive attitude.
But more importantly, there is a specific instruction to actively let the person know that you enjoy spending time with them and that you value their company.
I was really struck by that instruction to actively tell the patient you enjoy their company. Because if someone is deeply depressed, their brain is actively lying to them.
It's relentlessly.
It's telling them they're worthless or a burden to everyone around them. So wouldn't the patient in that state just assume a professional caregiver is lying to them because it's their job? How does a professional navigate that and make it feel authentic?
That skepticism is entirely expected in a depressive episode. The clinical strategy here relies on consistency and repetition. The patient's internal monologue is acting as this heavy counterweight to any positive input.
Right, so one nice comment won't fix it?
Exactly. A one-off compliment will absolutely be dismissed as a professional obligation. But when a caregiver consistently demonstrates day after day that they are not frustrated, that they are not rushing to leave the room, and that they genuinely value the human interaction, it slowly chips away at that internal narrative of worthlessness.
It wears down the walls.
Yes. Actionable empathy becomes a required part of the care plan. It is the active, repetitive practice of providing emotional encouragement until it finally pierces through the cognitive distortion of the illness.
But that emotional exhaustion we just talked about doesn't stay in the brain, though. It bleeds directly into the body. The guidelines actually pivot to treat this as a deeply physical illness.
It's a huge shift in the text.
It is. The text explicitly points out that people with depression may feel very tired or have severe sleep problems. It highlights a massive physical toll.
What's fascinating here is how the healthcare assistance role is designed to bridge the gap between emotional care and physical care. Because depression heavily drains a person's energy reserves, the protocol instructs the caregiver to actively encourage rest and proper sleep.
But managing that physical toll goes much deeper than just ensuring the patient takes a nap.
Much deeper. The text brings us into the actual mechanics of getting through a 24-hour period.
Yeah, the source focuses heavily on what are known as ADLs, or activities of daily living. The guidelines instruct the HCA to help with normal daily activities, specifically listing support for routines such as personal care, dressing, and other fundamental tasks.
Which is so crucial.
For someone who hasn't experienced severe depression, the idea of needing a medical professional to help you put on a shirt might seem really difficult to grasp.
To understand why this is a cornerstone of the guidelines, we have to look at ADLs as a medical concept. In a clinical setting, activities of daily living aren't just a casual to-do list. They are a standard scoring system. Doctors and nurses use ADLs to measure a patient's functional independence.
Oh, wow. I didn't realize it was an actual metric.
It is. And when a depressive episode hits, a patient's executive function, the part of the brain responsible for planning, organizing, and initiating tasks, is severely compromised.
So the brain just can't string the steps together.
Exactly. The cognitive load required to get out of bed, choose an outfit, manage the fine motor skills of buttoning a shirt, and brush one's teeth. It can feel equivalent to solving a complex calculus problem while carrying a 50-pound weight. It is completely overwhelming.
That is such a visceral way to describe it.
By stepping in to assist with these ADLs, the healthcare assistant is acting as a surrogate for the patient's depleted executive function.
It really reframes the illness. It shows that depression can make something as basic as brushing your teeth feel like climbing a mountain. Getting out of pajamas feels impossible.
And that physical, hands-on support from the HCA isn't about coddling the patient. It is incredibly vital to maintaining their basic human dignity when their brains simply cannot process the steps required to care for their own body.
Right, and functioning requires fuel. Which brings us to another major clinical component of these guidelines: nutrition and hydration.
Yes, the body needs literal energy.
The text mandates that HCAs must encourage the person to eat nourishing food and to drink enough fluids. Earlier, we talked about the core definition of the disorder, including a profound loss of interest in activities.
Right, anhedonia.
Yeah, anhedonia.
Mm-hmm.
That symptom frequently extends to eating and drinking, doesn't it?
It absolutely does. Food loses its taste. The physical act of chewing and swallowing feels like too much effort. The sensation of hunger itself can be completely blunted.
So they just stop eating.
Yes. So the caregiver has to actively step in, sometimes turning eating into a structured, assisted activity to ensure the body is receiving the caloric energy it needs to eventually recover.
It is a true full-body approach to a mental health condition. And the intervention extends beyond what goes into the body. It addresses the environment the body exists in.
The physical space matters immensely.
The source mandates that the HCA must provide a safe, secure, stable, and calm environment while following the established care plan. Because you simply cannot heal from profound mental and physical exhaustion in an environment that is chaotic, loud, or unpredictable.
No, you can't. That calm environment serves as the foundational layer of recovery. Once that safe, stable baseline is established, the text outlines another physical intervention that builds upon it, which is movement.
Yeah, the guidelines recommend encouraging physical activity and time outdoors. On the surface, telling a caregiver to encourage a walk outside sounds almost too simple.
It sounds like a motivational poster.
Exactly. It sounds like the kind of unsolicited advice you get from a stranger. But when you factor in the clinical reality of a patient who hasn't had the energy to leave their bed in 4 days, you realize this isn't about casually suggesting a stroll.
No, it is about executing a complex, gradual, and highly sensitive behavioral intervention. The clinical guidance points out that gentle activity and fresh air can help improve mood and energy. The key word there is gentle.
Right, you aren't training for a marathon.
If a caregiver pushes a severely depressed patient to do an intense workout, the patient will likely fail, which will only reinforce their internal narrative of worthlessness and physical inadequacy.
That would backfire completely.
Entirely. By starting with something as small as stepping onto a porch to feel the fresh air or walking slowly down a hallway, the caregiver is providing literal medicine. It stimulates blood flow, provides a change of sensory input, and offers a micro victory that the patient can build upon. It is a targeted strategy to slowly rebuild their physical resilience.
Here's where it gets really interesting, though. Once the physical routines, the nutritional needs, and the safe environment are being managed, the text shifts its focus towards something a bit more existential.
Moving from survival to living.
Exactly. It focuses on rebuilding connection and meaning for the person. The guidelines explicitly state that the HCA should encourage activities that help the person feel valued.
And that word valued connects directly back to the mandate we discussed earlier about actionable empathy. The protocol is incredibly consistent in targeting those feelings of worthlessness.
To combat this, the guidelines give very specific structured interventions. They instruct caregivers to support hobbies, facilitate social activities, and notably arrange interactions with pets whenever possible.
I love the inclusion of pets there.
I do too. But I want to dig into that specific list for a second. Hobbies, social activities, and pets. If a person is currently finding it impossible to even brush their teeth, how does a caregiver successfully introduce a hobby or a social event without completely overwhelming the patient?
It is a delicate balancing act. The strategy here is a direct counterattack on the symptom of isolation. Depression thrives in the dark. It feeds on a person's withdrawal from the world.
So you have to pull them back into the light. Careful.
Yes. By instructing the HCA to actively promote social interaction and build a support network, the text outlines a protocol for retethering the patient to society. But it has to be scaled appropriately.
What does that look like in practice?
A social activity might just be sitting in the same room as another person while drinking tea without any expectation of deep conversation. A hobby might just be holding a paintbrush or listening to a familiar piece of music. The goal is to find accessible pathways back to connection that demand very little cognitive energy from the patient.
The mention of interacting with pets in these professional medical guidelines is incredibly practical.
It really is brilliant.
For someone who is completely exhausted and finding it difficult to hold a conversation, interacting with a dog or a cat is the ultimate low-pressure situation. An animal doesn't need you to be witty. It doesn't ask you how you are feeling, and it certainly doesn't offer unhelpful advice.
It just wants to sit with you.
Yeah. The source recognizes that nonverbal, zero-demand companionship as a highly effective way to help the person feel valued.
Animals offer unconditional positive regard, which is a powerful therapeutic tool. The broader objective the text highlights is to encourage hope and provide emotional encouragement.
Finding that small spark.
Exactly. Finding a small spark of joy in a low-stakes hobby, feeling the warmth of a pet, or successfully navigating a 5-minute social interaction. These are tangible, bite-sized ways to inject hope into a person's day. It is a slow, steady rebuilding of their engagement with the external world, meticulously guided by the caregiver.
It paints a picture of a very gentle, persistent, and deeply compassionate style of care. The HCA is managing meals, facilitating walks, bringing in a therapy dog. But as we move to the final section of these guidelines, there is a very necessary and sharp shift in tone.
Yes, the stakes get very high.
While the HCA is doing all of this daily support, they are also positioned on the front lines of something much more severe. The text shifts to the most critical, high-stakes aspect of the caregiver's job, which is watching for warning signs of suicide.
This raises an important question for anyone in a clinical or caregiving role. How do you reconcile the gentle, encouraging persona required to support hobbies and hydration with the intense, hypervigilant mindset required to keep a person from ending their own life?
It sounds almost impossible to balance.
The framework answers this by making vigilance an integrated, mandatory part of the daily routine. The caregiver is always observing, even during the seemingly lighthearted moments.
And the protocol removes any guesswork from this process. It explicitly lists 4 distinct warning signs of suicide that the healthcare assistant must be constantly scanning for. Let's walk through exactly what the text outlines. Number 1, talking about death. Number 2, feeling hopeless. Number 3, giving away possessions. And number 4, having a plan to harm themselves.
The inclusion of these specific behavioral markers trains the caregiver to recognize the precursors to a crisis, not just the crisis itself.
Right, catching it early.
Talking about death and having a plan are universally recognized red flags, but feeling hopeless and giving away possessions are far more insidious.
Giving away possessions really stood out to me.
It is a profound psychological indicator. It signals that a person is wrapping up their affairs, seeking a terminal sense of closure because they have entirely lost the hope the HCA has been trying to cultivate. It is an action taken when a person has made a definitive internal decision that they will not need their worldly attachments anymore.
If a caregiver spots someone giving away a beloved piece of jewelry or a favorite book, the text gives absolutely no wiggle room on how to respond. It outlines a very strict protocol. If warning signs appear, inform the nurse or supervisor immediately.
That immediate escalation is non-negotiable. The HCA is not tasked with counseling the patient out of a suicidal crisis themselves.
They aren't expected to be the therapist in that moment.
No, they're not supposed to try and talk the person down using the empathy techniques we discussed earlier. They are instructed to report their concerns immediately, triggering the chain of command.
Passing the baton.
Exactly. This ensures that the moment the risk elevates to a matter of life and death, the broader medical team, the doctors, psychiatric nurses, crisis interventionists, is instantly activated. The system relies on the HCA being the eyes and ears on the ground, but it explicitly relies on the larger medical apparatus to handle the acute crisis.
It really brings the immense burden and responsibility of the HCA into sharp focus. I mean, they are making sure you eat your breakfast. They are telling you they genuinely enjoy your company. They are helping you find a clean shirt. And all the while, they are professionally trained and legally required to look for the subtle signs that you might be in immediate life-threatening danger.
Synthesizing the core takeaways from this document reveals exactly why healthcare assistants are the backbone of this type of recovery. Their daily actions directly support the emotional well-being, the physical safety, and the basic functioning of people living with depressive disorders.
They are holding up the sky for that patient.
Beautifully said. When a patient's internal foundation is severely weakened by mental illness, the HCA steps in to become the external scaffolding. They hold up the structure of the patient's daily life, managing the cognitive load and physical requirements of existence until the patient's own strength begins to return.
And even if you are not a professional healthcare assistant, even if you are just a friend, a partner, or a family member trying to support someone you love, these professional guidelines are an absolute goldmine of practical application.
They translate perfectly to everyday life.
They do. Understanding the clinical reasoning behind why you shouldn't dismiss feelings, recognizing that helping someone with a basic task like doing their laundry is actually lifting a massive cognitive load, or knowing that encouraging a 5-minute walk is a valid behavioral intervention. These are incredible tools.
And knowing the warning signs could literally save a life.
Exactly. Knowing the real warning signs, like a sudden desire to give away possessions, means you are vastly better equipped to protect anyone in your life who might be quietly struggling.
Yeah.
So what does this all mean?
It's a lot to process.
It is. We've spent our time today analyzing a clinical outline of care, but at its very core, this is a document about the mechanics of how human beings keep each other alive. And I want to leave you with one final thought to ponder, building on a striking paradox hidden within these specific guidelines.
Oh, the paradox between the possessions and the pets.
Yes. The source explicitly warns that giving away possessions is a major red flag, a terrifying, actionable sign of hopelessness. Yet, just a few sections earlier, it highlighted supporting a patient's hobbies and arranging interactions with pets as key targeted ways to make someone feel valued and tethered to the world.
The contrast is amazing.
Think about the profound, undeniable power of attachment in human survival. When a person's internal energy is completely depleted, when their mood and their own thoughts are actively conspiring against them, sometimes the sheer, simple reality of having a dependent animal to care for, or a beloved, useless object we refuse to part with, becomes the quietest, strongest anchor we have left. Our seemingly trivial attachments to the physical world outside our own heads might just be the very mechanisms that save us when the internal world becomes too heavy to bear.